Part 2 of our classic relevant rapid review for classic relevant treatment. We ended up at acute promyelocytic leukemia. Treatment is all transretinoic acid. The drug of choice of anticoagulation in pregnancy or renal failure is low molecular weight heparin. For heparin reversal, the treatment is protamine sulfate. For immediate anticoagulation, treatment is heparin. Long-term anticoagulation, you can use warfarin, dabigatran, rivaroxaban, and apexaban. For warfarin reversal, the treatment is fresh frozen plasma for the acute warfarin toxicity and vitamin K for non-acute warfarin toxicity. For cyclophosphamide-induced hemorrhagic cystitis, treatment is Mesna. For HER2-neo breast cancer, treatment is trastuzumab. For osteoporosis, treatment is calcium plus vitamin D supplementation. You can use this as prophylaxis. We have also bisphosphonate, parathyroid hormone analogs. We have the SERMs, the selective estrogen receptor modulator. We have calcitonin. Denosumab is also used for treatment. Osteomalacia or rickets, treatment is vitamin D supplementation. For chronic gout, treatment is xanthine oxidase inhibitors such as allopurinol and febuxostat. You can use also pegloticase and probenecid. For acute gout attack, treatment is NSAIDs, colchicine, glucocorticoids. For neural tube defect prevention, treatment is prenatal folic acid. For migraine, treatment is abortive therapies such as somatriptan, NSAIDs, and for prophylaxis, you can use propranolol, topiramate, calcium channel blockers, amitriptyline. For multiple sclerosis, treatment is disease-modifying therapies such as beta-interferon, natalizumab. For acute flares, you can use IV steroids. For degeneration of dorsal column fibers, tabes dorsalis, associated of tabes dorsalis, this is tertiary syphilis. Subacute combined degeneration is associated with dorsal column or lateral corticospinal spinocerebellar tract is also affected. So this is not a treatment. For tonic-clonic seizures, treatment is levetiracetam, phenytoin, valproate, and carbamazepine. For absence seizure, treatment is ethosuximide. For trigeminal neuralgia or tic douloureux, treatment is carbamazepine. For malignant hyperthermia, treatment is dantrolene. For anorexia, treatment is nutrition, psychotherapy, and selective serotonin reuptake inhibitors, SSRIs. For bulimia nervosa, treatment is SSRIs. For alcoholism, treatment is disulfiram, acamprosate, naltrexone, and supportive care. For ADHD, treatment is methylphenidate, amphetamines, the CBT, atomoxetine, guanfacine, and clonidine. For alcohol withdrawal syndrome, treatment is long-acting benzodiazepines. For bipolar disorder, treatment is mood stabilizers such as lithium, valproic acid, carbamazepine, and atypical antipsychotics. For depression, treatment is SSRIs as first line. For generalized anxiety disorder, treatment is SSRIs or selective serotonin reuptake inhibitor. We have also serotonin and norepinephrine reuptake inhibitor or SNRI, that is the first line, and the buspirone, that is the second line. For schizophrenia positive symptoms, treatment is typical and atypical antipsychotics. For typical haloperidol and atypical antipsychotics such as risperidone or quetiapine and other atypical antipsychotic. For schizophrenia negative symptoms, treatment is atypical antipsychotics. For hyperaldosteronism, treatment is spironolactone. For benign prostatic hyperplasia, treatment is alpha-1 antagonist, 5-alpha reductase inhibitors, and the PDE5 inhibitors, phosphodiesterase 5 inhibitors. For infertility, treatment is leuprolide or the gonadotropin-releasing hormone. This is in pulsatile use, and clomiphene. For the breast cancer in postmenopausal women, treatment is aromatase inhibitor or anastrozole. For ER-positive breast cancer, treatment is tamoxifen. For prostate adenocarcinoma or uterine fibroids, treatment is leuprolide and GnRH, that is continuous. So gonadotropin releasing hormone, GnRH. Medical abortion, treatment is mifepristone. For prostate adenocarcinoma, treatment is flutamide. For erectile dysfunction, treatment is sildenafil, tadalafil, and vardenafil. For pulmonary arterial hypertension, that is idiopathic, treatment is sildenafil, bosentan, and epopristol. That's all for the rapid review for relevant treatment with classic condition. Thank you. The source of this rapid review is the First Aid USMLE 2019. Thank you.